Hey guys, this is Dr. Moore with Cumberland Chiropractic and Sports Medicine. Today we are talking about some common causes of elbow pain. So if you're someone that suffers with elbow pain, either acute or chronic, you're going to want to hear this, so stick around. Alright guys, so again, today is all about elbow pain and causes of elbow pain. I've got my arm taped up here as a visual representation of the conditions that we're talking about. The first ones that we're going to talk about are the most common causes of elbow pain probably, and that is epicondylitis. There are two types of epicondylitis. You have lateral epicondylitis, represented by this black tape here. The elbow pain that you'll feel will be here on the sides of the elbow and sometimes work its way down to the top of the forearm. The other epicondylitis, medial epicondylitis, is represented by this purple tape. It is here on the inside of the elbow and can sometimes run down in this flexor group, the muscles that you use to flex the wrist. Both of these conditions are caused by an overuse or a strain of the muscle groups that you use to control your hand. It'll feel like sharp pain that is irritated with certain wrist movements. Okay, so the next piece of tape we're going to talk about is this blue line here. This blue line represents the radial nerve, and the radial nerve can become irritated or entrapped as it wraps around the side of the arm here and courses through the muscles of the forearm. So why is that important? Well, because sometimes, even though this typically causes numbness, tingling, or irritation down in the hand or forearm, it can initially start or also present with some outside of the elbow pain, some sharp nagging pain that happens with certain movements. So it can be confused with this lateral epicondylitis, this black tape that we just talked about. Same thing with this greenish yellow piece of tape around the inside of my forearm here. This tape represents the ulnar nerve. The ulnar nerve wraps around the inside of the elbow. It's responsible for that funny bone feeling you get every once in a while if you hit your elbow up against something. And this nerve can become entrapped as it wraps around this bone here at the elbow or through the forearm. And although it causes some numbness, tingling on the outside of the hand and into this pinky finger, it can sometimes cause some sensitivity, some irritation up here in the elbow area. So it can be confused with this purple tape, the medial epicondylitis that we just talked about. Okay, so the bottom line is, even though the elbow seems like a simple structure and how much could be going wrong with your elbow to cause you elbow pain, there are several different reasons you might have elbow pain or other symptoms into the forearm. So what we try to do here in our office is be really good about picking apart what it is that's causing your symptoms, causing your problem, and that can mean all the difference between your problem lasting you several months to a few weeks. And that's what we're all about. We want to get you the best results as quick as possible. So if you have elbow pain, give us a call. We'd love to help you with your problem. If you like this video, give it a thumbs up. And if you know someone who needs to see it, please share it with them. If you have any questions or comments about any of the stuff that we talked about, please leave it with the video. This has been Dr. Moore with Cumberland Chiropractic and Sports Medicine, where we get you better, faster.